Prednisone Intensol is a medication that is used to treat a variety of conditions including arthritis, blood disorders, breathing problems, severe allergies, skin diseases, cancer, eye problems, and immune system disorders. It belongs to a class of drugs known as corticosteroids. Prednisone works by decreasing the immune system's response to various diseases, which helps to reduce symptoms such as swelling and allergic-type reactions. The daily dosage and timing for taking Prednisone Intensol should be determined by your doctor based on your specific condition. It is important to follow your doctor's instructions carefully when taking this medication. When taking Prednisone Intensol, it's important to take it with food or milk to avoid stomach upset. Use the dropper that comes with your medication to measure the dose accurately, and do not use a household spoon. You can mix the medication in juice or applesauce before taking it. If you are prescribed only one dose per day, take it in the morning before 9 a.m. Follow your doctor's instructions for taking Prednisone Intensol, as the dosage and length of treatment will depend on your medical condition and how you respond to the medication. If you are taking it on a different schedule than daily, such as every other day, it may help to mark your calendar with a reminder. Do not stop taking Prednisone Intensol without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. You may experience symptoms like weakness, weight loss, nausea, muscle pain, headache, tiredness, and dizziness. To prevent these symptoms while stopping treatment, your doctor may reduce your dose gradually. Be sure to report any new or worsening symptoms to your doctor right away. If your condition persists or worsens, be sure to inform your doctor. Some common side effects of Prednisone Intensol may include nausea, vomiting, loss of appetite, heartburn, trouble sleeping, increased sweating, or acne. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. If you experience any serious side effects, such as muscle pain/cramps, irregular heartbeat, weakness, swelling in the hands/ankles/feet, unusual weight gain, signs of infection, vision problems, symptoms of stomach/intestinal bleeding, mental/mood changes, slow wound healing, thinning skin, bone pain, menstrual period changes, puffy face, seizures, or easy bruising/bleeding, it's crucial to contact your doctor immediately. This medication may rarely raise your blood sugar, potentially causing or worsening diabetes. If you experience symptoms of high blood sugar, such as increased thirst/urination, or if you already have diabetes, it's important to monitor your blood sugar regularly as directed by your doctor. While a serious allergic reaction to this product is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not listed here, it's important to contact your doctor or pharmacist. And remember, always consult your doctor for medical advice about side effects. Before taking Prednisone Intensol, it's important to let your doctor or pharmacist know if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have had infections, heart problems, high blood pressure, thyroid or kidney disease, liver disease, mental/mood disorders, diabetes, seizures, or any other conditions. Long-term use of corticosteroid medications like Prednisone Intensol can make it harder for your body to respond to physical stress. If you are planning to have surgery or emergency treatment, or if you get seriously ill or injured, be sure to tell your doctor or dentist about your medication use. Prednisone Intensol may also mask signs of infection, making you more susceptible to getting infections or worsening current infections. Take precautions to avoid contact with anyone who has a contagious infection, and consult your doctor if you have been exposed to an infection. It's important to be cautious if you have diabetes, liver disease, or any other condition that requires you to limit or avoid sugar and alcohol, as Prednisone Intensol may contain these substances. Before receiving any immunizations or vaccinations, be sure to inform your healthcare professional that you are using Prednisone Intensol. Avoid contact with people who have recently received live vaccines, and limit alcoholic beverages while using this medication. If you are an older adult, you may be more sensitive to the side effects of this drug, including bone loss, stomach or intestinal bleeding, and mental/mood changes. And for children using this medication for a long time, it may slow down their growth, so it's important to consult the doctor regularly for monitoring. If you are pregnant or breastfeeding, discuss the risks and benefits of using Prednisone Intensol with your doctor. It may rarely harm an unborn baby or cause hormone problems in a nursing infant, so it's crucial to seek medical advice before using this medication during pregnancy or while breastfeeding. Drug interactions can affect how well your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Don't make any changes to your medication without consulting your doctor first. Some products that may interact with Prednisone Intensol include aldesleukin, mifepristone, and drugs that can cause bleeding or bruising, such as antiplatelet drugs and blood thinners. If you have been prescribed low-dose aspirin for heart attack or stroke prevention, continue taking it unless your doctor tells you otherwise. It's important to discuss this with your doctor or pharmacist for more details. It's also important to be aware that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform all your healthcare providers about your use of this drug. As for the daily dosage and optimal timing of Prednisone Intensol, always follow your doctor's instructions. If someone has taken too much Prednisone Intensol and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, it is advisable to contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. If you are in Canada, you can call a provincial poison control center for assistance. It's important not to share Prednisone Intensol with others. If you are taking Prednisone Intensol for a long period of time, your doctor may recommend lab and/or medical tests to monitor your health, including blood mineral levels, blood glucose, complete blood count, height/weight measurements, bone density tests, blood pressure, and eye exams. It's important to attend all of your medical and lab appointments and consult your doctor for more details. Using Prednisone Intensol for an extended period may lead to bone problems, such as osteoporosis. Your doctor may suggest lifestyle changes to help reduce the risk of bone problems, such as engaging in weight-bearing exercise, ensuring you get enough calcium and vitamin D, quitting smoking, and limiting alcohol. It's important to discuss with your doctor any lifestyle changes that might benefit you. If you take Prednisone Intensol daily and forget a dose, take it as soon as you remember. If it's close to your next dose, skip the missed one and take the next dose at the regular time. Don't take double the dose to make up for the missed one. If you take Prednisone Intensol on a different schedule, like every other day, ask your doctor beforehand what to do if you miss a dose. It's important to store Prednisone Intensol at room temperature, away from light and moisture. Remember not to store it in the bathroom. Once the bottle is opened, the medication expires after 90 days. Make sure to keep all medications out of reach of children and pets. When it comes to getting rid of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Always properly discard the product when it's expired or no longer needed. If you're unsure of how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.